Welcome to Kidney Plugged In, Dr. Gogan. Dr. Gogan, what is one of the most important things about kidney disease and kidney health that people should know?
I think the most common thing would be it's more common than you think it is. Everyone thinks of heart disease, lung disease, cancer, and they don't realize that kidney disease is actually very common. Probably 1 in 10 people suffer from kidney disease. They may not even know it, and that rate is increasing. And it's silent. There's no symptoms when you are early on with kidney failure. You actually don't have symptoms till you're probably less than 20% kidney function, and you don't need dialysis till you're less than 10%. So having people aware of kidney disease and understanding who's at risk and looking for early detection can make a big difference, because it can really slow down progression. So when you look at causes of kidney failure, our number 1 cause is probably, let's say, high blood pressure. Number 2 cause is diabetes. And you look at people, there's so much diabetes, high blood pressure, then people at risk, people who maybe are overweight, people who have heart disease, maybe have had a stroke, they have circulation issues. If you've got a family member, certain ethnic groups are more at risk. These people should be thinking of their kidneys and approaching their family, their primary care provider, for testing.
What are some of your top tips for keeping your kidneys healthy?
Well, when you look at the causes of kidney failure, it kind of brings you to the top tips. So if you say high blood pressure is a number 1 cause, I'd say know your blood pressure. And these days with, after COVID and so much of healthcare is virtual, I actually feel everyone should own a blood pressure monitor. Some drug plans will cover it. There's different places you can go that cost, different prices of them. There's ones for your arm, there's one for your wrist, they're at pharmacies, there's at gyms. Just check your blood pressure. If you feel that the cost of a blood pressure monitor is too much for you, the Kidney Foundation will actually provide one for you if you contact them. And so I feel very strongly that everyone should know their blood pressure. And then the next thing was diabetes being the number 2 cause. Everyone should know their glucose or get a glycosylated hemoglobin done. And this would require a visit to your family doctor. And if you're visiting your family doctor, then you might as well ask for a serum creatinine, which gives your kidney function, get a urinalysis and a urine albumin creatinine ratio. And then we have everything we need to kind of say, well, wait a minute, are you at risk? Is there anything going on with your kidneys right now? So that becomes very important.
What is one of the key messages you share with your kidney patients as they're on their journey with kidney disease?
So there's an awful lot you can do, because some people, when they get a diagnosis that they have kidney disease, it just terrifies them and they stop. But there's things you can do, and you don't need to become an angel and do everything perfectly. You just need to do things that may improve your blood pressure, for instance, which may be like exercising, a little bit of weight loss, cutting back on salt in your diet, maybe cutting back on alcohol. Things like that can make a big difference to blood pressure. Losing weight, exercise can really help offset if you're diabetic. Another big one that people probably are not aware of is medications. Everyone should know what medication they're taking and what it's for. And even over-the-counter medications matter. Anything you put in your mouth matters. And so if you're looking at one of the most common medications out there are what we call non-steroidal anti-inflammatories. So things like ibuprofen, Aleve, naproxen, those anti-inflammatory medications, which are great when you need them, but they actually raise blood pressure and decrease blood flow to the kidneys. So they never were meant to be a medication you take every day all the time. Now, unfortunately, there are some groups who do need to take those medications every day, and that's a different situation. But know that every medication you take has some good effects and some bad effects, and be sure that you really need to take it before you take it.
Final thoughts or words of wisdom to share with our viewers?
So I think the final message I'd want to say is, my special area of interest is transplant, but I work in a province that actually doesn't do transplants, so I follow them afterwards. So I'm really a general nephrologist. I see all kinds of nephrology problems. But I think one of the key messages, what I want to say to people is, if you are diagnosed with kidney disease, and it's a terrifying thing to hear and it may floor you, but I want to say you're not alone. First of all, the other comment I make to patients, it's what we do. I hope we do it well, otherwise we shouldn't be doing it. You know, we've been doing it for many years. And when you get diagnosed with kidney disease, there's a whole team that looks after you. There's your primary healthcare provider, your nephrologist, there's a whole lot of nurses with different areas of expertise. There's pharmacists, dietitians, social workers, psychologists. We have all these people available to help you through it and optimize your health and slow down the damage to your kidneys. And finally, there's the Kidney Foundation, which is a wealth of information that can help you in this journey as well to optimize what your health can be. And as I said before, slow down the damage. So I guess my message is it's not alone, and it's never too late to make a change. And you don't have to become perfect in every way to make that change. Sometimes it's just a little nudge in the right direction makes a big difference.
Thank you so much, Dr. Gogan, for
Sure.
joining
Well,
us
thank
today
you.
on Plugged In.
All
And
right. Thanks for having me.